Like to call our House Health Committee to order. Will the clerk please take the roll?
Representatives Bain, Boyd, Capley, Carringer, Clemens, Faison, Farmer, Gillespie, Hakeem, Hawk, Haynes, Hemmer, Hicks of Hawkins, Hicks of Washington, Hill, Jernigan, Kumar, Martin of Carroll, Mitchell, Rudder, Sherrill, Travis, Vaughn, Whitson, Williams, Vice Chairman Leatherwood, Chairman Terry.
Here.
Chairman, you have a quorum.
All right, thank you. And before we get started, do any of our members have any personal orders? All right, seeing none, I'm going to take a personal order and ask for a moment of silence for one of our former members, Judd Matheny. He passed away yesterday. Some of us worked with him for quite a while, and he gave us some advice. And I sat near him on the house floor, and still to this day, one of his pieces of advice he gave me is the juice worth the squeeze? And so, for Judd Matheny, let's take a moment of silence. Amen. Thank you. All right, we have 21 items on our calendar today, and so let's go with item number 1, House Bill 1339. Leader Camper, you are recognized. You have a motion and a second.
Thank you, Mr. Chairman and committee.
I believe you have an amendment. Is that correct?
I do, Mr. Chairman, drafting code 017098.
Okay, and it rewrites the bill 017098. I need a motion. We have a motion and a second. Without objection, let's go ahead and get that on the bill. All those in favor say aye. Opposed? Ayes have it. We are on the bill as amended. You're recognized.
Thank you, Mr. Chairman. Sorry. I didn't know you was gonna bring Judd Matheny up.
Oh,
I had a very historic bill. He was a speaker pro tem at the time. And we were told we would not be able to get this bill passed. But we worked so hard together to get it done, Chairman Faison. And I had an emergency to come up at home the day the bill was on the floor. And I had to leave. And it was Judd Matheny that said, I'm gonna get this bill out for you today. I was gonna roll it and all. He said, nope, we're gonna do it now. And so Matheny helped me get that bill done when he didn't have to. And ironically enough, and you brought him up, so I just gotta talk about it. We was about to lose the bill in the Senate. And my staff was, leader, get down here. You're about to lose your bill. You gotta get, not leader, County Representative. And it was Matheny that ran to the Senate, walked in that door, and they said, oh, I see the Speaker Pro Tem is in the House. You want to speak on this bill? Oh, yes. And he got up there and he testified, and he got that bill out of the Senate. And we passed that bill together. So I had that. When you mentioned him, it just kind of came over me. So sorry, members.
Oh.
Thank you for your patience. I appreciate that. Condolences to his family. What this bill does, Mr. Chairman and committee, is it authorizes and encourages the Department of Human Services to actively seek and apply for and then utilize federal grants for the funding purpose to alleviate childhood hunger. We've been working with the department on this. We're going to provide a report every year on February the 1st, and a report back to this committee and the committee in the Senate on the funds that were received and how we use those funds to alleviate hunger. And it just passed in the Senate unanimously to calendar. I'd appreciate a favorable vote.
all right. Thank you. Do we have any questions A question has been called, so we are voting on House Bill 1339 as amended. All those in favor say aye. Opposed? Ayes have it. Bill goes on to calendar and rules. All right,
Thank you, Mr. Chairman and
members,
committee.
Leader Camper is also carrying item number 10, House Bill 2222. And so we're going to go out of order and recognize Leader Camper.
Thank you, Mr. Chairman and members of the committee.
Need a motion?
Could I get a motion second?
Okay, you have a motion and a second, and
Thank you. There's an amendment that we've been working on with the department, and I'd appreciate a motion, drafting code 017788.
okay, you have a motion and a second on that amendment. Again, it rewrites the bill, so if there's
It
no
does.
objection, let's vote on amendment 017788. All those in favor say aye. Aye. Opposed? Ayes have it. We are back on the bill as amended. You are recognized.
Thank you, Mr. Chairman. Mr. Chairman, in committee, Representative Love has been working feverishly on this bill. He had to leave town and asked me to carry it for him. It is a bill that would require the Department of Health to conduct a review and issue a report to the General Assembly on the variants of APOL1 gene, which is associated with increased risk of end-stage renal disease. It's the report would include an awareness of it, screening, genetic testing, any analysis that the department feel needs to be done, and then report back to us any identifying measures we need to look for to address this disease. With that, I'd appreciate your support and vote. Open for questions.
All right, any questions for the sponsor of the bill? All right, seeing none, we're going to vote on House Bill 2222 as amended. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to calendar and rules.
Thank you, Mr. Chairman and committee.
And you also are carrying House Bill item number 11, House Bill 2226. Is that correct?
It is, Mr. Chairman.
Okay, I need a motion. You have a motion and a second. And we have an amendment that rewrites the bill. Is that correct?
I don't think I have an amendment, Mr. Chairman, on this one.
It's the one that came out of sub 015087.
I don't have that. Maybe I'm not correct in this. This is 2226.
Okay, we have a motion, a second on that amendment. It rewrites the bill.
Okay.
It's the one that came out.
I don't see the amendment. Where is it? The next one, this one.
Is it this one? Which one?
2226.
Okay. Is that the amendment you have?
That's right, 0567.
Okay, I see. Yeah, thank you. All right.
We got it?
Appreciate it. Thank you.
All right, if there's no objection, let's go ahead and vote on amendment 015087. All those in favor say aye. Opposed? Ayes have it. We are on the bill as amended. You are recognized.
Okay, thank you, Mr. Chairman. Forgive me, I didn't have a copy of the amendment, but you're right. It makes changes to the membership of the maternal mortality review board. We already have this commission, and what this is doing is making a change to it with the appointment of the members to the board representative of the 3 grand divisions. Where are those numbers? So it will consist of 2 from the east, 2 from west, 3 from middle, and 4 from southeast Chattanooga region, and 4 from Memphis, Tennessee, West Memphis, Tennessee region. So it'll be made up of 5 different regions, and appointments will be based on 2, 2, 3, 4, and 5. That's what the changes are.
All right, do we have any questions for the sponsor of the bill? All right, question has been called. All those in favor of House Bill 2226 as amended, say aye. Opposed? Ayes have it. Bill goes on to government operations.
Thank you, Mr. Chairman, committee.
All right, thank you, members. And that brings us back to item number 2, House Bill 24 97. Representative Hurt, you are recognized. I believe you have an amendment.
Thank you, Mr. Chairman. Yes, I do have an amendment. Amendment number 017868.
Need a motion? Okay, you have a motion and a second. That rewrites the bill. So if there's no objection, let's get that on the bill. All those in favor say aye. Opposed? Ayes have it. We are back on the bill as amended. You are recognized.
Thank you, Mr. Chair and committee. Members, I think at this point, we're all familiar with what we're trying to do with this legislation. This state has a very dark history of institutionalizing individuals with disabilities. The atrocities that occurred in this state years ago can neither be understated nor ignored. I'm proud that those very dark days are behind us for good. We will never go back to institutions and mistreatment. Our state has come a long way since that time. However, our state now faces new challenges and a new day. We have many adults with intellectual and developmental disabilities who are aging alongside their parents. Due to lack of options, many adults are at home, often isolated with their aging parents or family. Meanwhile, the parents and family members fear where their adult children will go once the parents or families pass on. This bill sets up a pilot project to allow for a very much needed option, an option that is being used and is very successful in a significant number of other states. We will be providing homes for no more than 66 adults in Middle and no more than 24 adults in West Tennessee. Those numbers cannot change unless we, as the General Assembly, pass a new law. None of the homes built can have more than 8 individuals with intellectual or developmental disabilities living together. Tennessee currently has a limit of 4, but most other states allow more than 8. These adult homes will be part of a community that include neurotypical adults and families also. Daily aspects and activities of the individual's experience will be based on their individualized support plans. The department and nationally recognized third parties will conduct oversight and reviews of both participants and report annually to this committee. There are multiple parties that have worked together to get this legislation to this point. With this amendment, we will make sure our very special adults are protected and happy. Brightstone and Gloriana want to be part of the solution for Tennessee families by offering an innovative, supportive, and highly inclusive environment for their loved ones to thrive in a manner that suits their individual needs and wishes. And with that, Mr. Chairman, I'll be glad to take any questions. I know there are individuals on the list to speak on this, and I'm open for questions.
All right, thank you. And we have a significant list of people here that would like to testify. And so if there's no objection to the members, I'd like to have them come up. And since there's, looks like there's 7 on the list, if we may need an extra chair down there, but I was just going to have them all come up, testify, and then at the end of each one's testimony, then we can take questions. So is there a Mike Carnes? Okay, if you can grab a seat. A Jackie Cansier, Charles Trammell, Donald Redden, Roddy Coe, looks like Park Pepper, and then Carol Westlake. All right, we're going to go out of session. And if you can, each of you, I'm going to give you 2 minutes. If each of you speak into the mic, turn the mic on, tell us who you're with, and then you can begin your testimony. We'll start here on the far left.
Am I on?
You're
Okay,
good.
good deal. Thank you. Members of the committee, I'm Carol Westlake. I am the executive director of the Tennessee Disability Coalition. The coalition is about a 34-year-old organization that represents nearly 40 disability groups across the state, representing people of all ages and all disabilities. I really wanted to come here today to talk a little bit about history, because I've been doing this for a long time. Probably at least 35 years ago, I was before this committee to argue for limiting licensure for services for people with intellectual and developmental disabilities to 8 beds or less. And the great body actually passed that law and required that those houses be 500 yards apart. And the reason they did that was because an operator had come into our state and said that they were going to build 4 64-bed facilities, private facilities in this state to house people with intellectual and developmental disabilities. 38 years ago, we knew that was wrong. In 1998-99, during the Sundquist administration, there was a law revision commission that totally rewrote Title 33, which is the department's law. And there was a public-private commission that worked together, appointed by the governor, that completely rewrote the code. That commission involved over 1,000 family members and people with disabilities and professionals in the state, and they lowered the licensure number to 4 beds because that they knew from the research, from people's lives, and from what people with disabilities told them, that that sort of family-sized home in an integrated environment gives people more choice and more freedom. We do have a problem in this state with services for adults with intellectual and developmental disabilities. Our service system isn't what it should be. It needs to be, we need more services, we need better services, we need services that are designed in different ways. But we don't need to try to circumvent the current licensure law that's been in place now for more than 25 years in order to do that. Thank you.
All right, thank you. And then, sir, if you can just give us your name and who you're with, and then we'll start your 2 minutes.
My name is Donald Redden. I'm the Executive Director of Developmental Services in Dixon. I've been there for a little over 40 years. I'm also was the parent of a young son with severe disabilities who we lost some years back. I come here today not to denigrate Brightstone or any other organization that has a history of serving people with disabilities. Instead, I've come to talk about what I believe will be the impact of this bill if it's passed in Tennessee. For the last 20 years or so, Tennessee has been a proponent of a service model that focuses on supporting people with a disability in an individualized, inclusive, community-scale setting. It's person-centered and seeks to give the individual opportunities to make choices in their daily lives and to make decisions about where and how they live. The model stands on the principle that people with disabilities can make decisions for themselves, including where to live and where to work. The service model is in contrast to an institutional congregate model being proposed in this bill. For many years, services followed this congregate model. The result was inhumane living conditions for many people and decades-long federal litigation. We realize that separate is never equal and abandoned congregate services and moved to the community-based inclusive service. The community service system in Tennessee is recognized nationally as one of the best, most progressive service systems. Are there problems? Absolutely. We suffer from a lack of staff to come into the homes. We suffer from funding, and we see growing waiting list. One of the things about the services we provide now, though, they've been accentuated by you, by the funds that you've passed with the governor to pay people better. So it's improving, but it's not where it needs to be.
All right, thank you, sir. That's been 2 minutes. We'll have questions, and so they'll probably come back to you. All right, next on our list. Tell us your name and who you're with.
I'm Roddy Coe. I'm dad.
Yeah.
Like I said, my most important title is dad. I'm also an Army veteran. I'm a current council member on the Council on Autism Spectrum Disorders, and I'm a former member of the Council on Developmental Disabilities. Ethan calls me dad. He's 17 and he has autism. When he was first diagnosed, I was told his future would be in an institution. I started looking into these and learned of the abuses and the nightmares that existed here and in so many other places. Like many in the disability community, I celebrated when I heard they were closing. Tennessee currently has programs to help these individuals live inclusive lives in their home communities. Please support those programs and keep individuals out of long-term residential facilities that do not support their growth or independence. This bill is allowing 8 residents to 1 staff member. This doesn't account for behavior escalation due to confined spaces. This bill also doesn't require facilities to have any experience with individuals with IDD. How are they going to know how to support these individuals? Legislation needs to ensure the rights and safety of residents in these facilities are guaranteed, not attempted. This program, as written, is not improving the lives for most Tennesseans and does not help improve the public welfare. I hope that this committee will vote no and work with disability community partners to ensure that a program that is created benefits Tennesseans. Thank you.
Thank you. Sir?
Good afternoon, Chairman, Vice Chairman, and committee members. My name is Mike Carnes. I am the chairman of the board of Brightstone. I'm also on the board of directors of Special Olympics. I'm the CEO of Joybridge Kids, which is a clinic that supports therapeutic services for kids with autism. And I'm a father of a son who has autism. We are bringing a solution to a huge problem in Tennessee. We have a massive number of adults, thousands and thousands with intellectual and developmental disabilities in Tennessee who are at home with their aging parents. And as these parents get older and older, it becomes less capable to take care of them. And what they worry about the most is what happens to them when they pass. Well, we're bringing you an option, 2 beautiful options. This does not replace the existing bill. It provides an exception for a pilot program for these needed services. This is how you innovate and move forward, as we will be bringing some of the best practices from around the country. Brightstone is an ungated community located a stone throw away from downtown Franklin, where our adults are very active in the community. We have an incredible day program that is now in the 25th year. We just got licensed for 2 residences, and this bill will allow us to add more. We already have 3 homes with neurotypical families on the same property. And yes, you've heard some of the objections, and we get it and understand their concerns. And there were some bad situations many years ago, but we are home building. We are not warehousing, we are not institutionalizing, nor segregating. In fact, quite the opposite. And we've listened. In the spirit of cooperation with the coalition and the council, we've included language in the bill to include neurotypical adults and cap the number of adults. We continue to follow and exceed DIDD licensure regulations. Our adults have jobs in the community, and most importantly, they can make choices. They absolutely can. In conclusion, I'd like to share that, as I mentioned, I have a son who is 26 years old with autism, and I'd absolutely have him in one of these homes, and I believe you would too if you were in my shoes. Thank you so much.
All right, thank you. And next on our list, if you can just tell us who you are and who you're with, and you've got 2 minutes. Thank you.
Thank you, Chairman Terry, members of the Health Committee. My name is Jackie Cancier, and I am the National Policy Director for the National Council on Severe Autism. I am also a member of SPPC for DIDD and a Partners Grad through the Council. I got brought into this a couple of weeks ago and really did my due diligence to meet with all of the parties involved before I came to my decision of strong support for this bill. And some of the opposition statements that I explored were in regards to, for example, the number of people from 4 or 6 and those kinds of things. A lot of it was misinformation, such as the statement of it being institutional congregate models. That is not at all what either of these 2 pilot participants are attempting. For something to be institutional, really what we're talking about is not the building. Really what we are talking about is the lack of control and choice that existed within those institutions. And that is not part of what these models have. Additionally, congregate, we all lived through the pandemic and understand at this point that congregate simply means together. In that instance, our very own CLS programs through HCBS and ECF very much can have an institutional or congregate factor with them right now. This program is looking to solve a problem. They're not asking for a penny from us. They have provided the donor funding. This is what the community wants. And in addition to that, self-determination is really what we need to be looking at here. In 1999, when we surveyed 1,000 people to see what numbers that we were going to land on, we didn't have the information we have today. Today, we do have quality control measures, which they have agreed to, and self-determination is built into this model, more so, I would say, than our current model. I think we have a lot to learn from these pilot programs, and I hope you vote yes.
Thank you. And last on our list, just tell us your name and who you're with, and you got 2 minutes.
My name is Dan Crowley. I am the parent of my 25-year-old son with intellectual and physical disabilities, who is a resident, will become a resident in one of the pilot program homes with Brightstone. I'm here to give you my experience with Brightstone, as well as our experience overall with, as an aging parent. I say that strugglingly to call myself aging. 2 years ago, we did not live in Tennessee. We lived in another state, and my wife and I had the opportunity to look for a path for our son for the rest of his life. As we age, we knew there would be a time where we could not take care of him. It is now that we need to plan for that, and we had options. I'm not saying we don't have options. We do have options. We looked at them. We looked at him living with us for the rest of his life, hiring people to come into our house. We looked at homes that were built in communities, homes that we knew parents had purchased and put there and hired people, or agencies that had bought homes and put people. But when we looked at those, I mean, I'm a little bit of a clown. We started to call them the illusion of inclusion, because they were not community. That's what we were looking for our son Jack, was a community, not just inclusion by our definition. So we looked nationwide for a location for Jack to be in. We found Brightstone. We looked at locations in South Carolina, Kentucky, Texas, Illinois, California. When we found Brightstone, we found a place that had a vision for building a community around adults with disabilities, not just a place for them to be. So we actually relocated to Tennessee, because it's not just about Jack, it's also about Beth and I. We could find a solution like Brightstone in other states. We choose to live in Tennessee. Without this, parents like me will have to go to other states. And we know the lifestyle of Tennessee is very valuable. We love Williamson County. We want to be geographically close to our son. This puts those two together for me. It puts those two together for other families like ours.
All right. Thank you for your testimony. All right. I'm starting a list of members here for comments. Chairman Jernigan, you're recognized.
Thank you. My question is for Director Westlake. When I can't see. Cap, there you go, buddy. I won't. So, to me, you probably have the most institutional knowledge of the history of where we've been the past 25, 30 years. If we were to go down this path, is this going to be are we going to be back on the radar screen of the DOJ and possibly in violation of our consent decree, which is a violation of Title II of the ADA and ultimately the ONSED decision? Do you think that would be something the DOJ would look at?
You're recognized.
Yeah, so thank you, Representative. I think that there are real risks About 25 years ago, there was a Supreme Court decision called Olmstead, which Representative Jernigan referred to, which found that segregating people with disabilities when they were capable of living in community and in living in more typical settings was discrimination based on the Americans with Disabilities Act. And there is a very good chance that programs that continue to segregate could open themselves up to a Department of Justice investigation and potentially a finding of that. It was interesting in that decision that you asked about. The Supreme Court ruled that the placement of people who can handle and benefit from living in community placements and have perspectives in that way really are subject to unwarranted assumptions that people are either incapable of or not worthy of living in typical communities. And I think that's a really, really important thing to think about. People with disabilities, I was watching a little video today where a young woman with Down syndrome was saying, you know, we are not broken people in a normal world. We are normal people living in a broken world. And, you know, for the folks that I know who have been bringing their kids up in integrated settings in schools for years and years and years are not in a position where they're going to expect their sons and daughters to be segregated and possibly risk an Americans with Disabilities Act complaint.
Chairman Jernigan.
Thank you. And so I know when we went down the path to fulfill the consent decree, that when Greenville closed, we became the 16th state in the nation not to have an institution in the state. If we do this, would that be considered opening up a new institution and us be off that list?
You're recognized.
You know, people have different definitions of institution. And Jackie kind of talked about that. I think that institution is sometimes not a building. It is absolutely sort of an attitude. And I think that those settings where people live without access to typical community, without, you know, on a campus, people have talked about dormitories, for example. You know, dormitories are something where you live for a couple of years and you can't wait to get out of college and live in a typical life. I can't think of 8 people that I would want to, that I could choose to live with that weren't my family, by the way, for the rest of my life. And I think those are the kinds of things that make this an institution.
Yep. And maybe institution was the wrong word, and congregate community would be more like that. So, yeah, that's all the questions I have for you. The rest of for my sponsor. Thank you.
Thank you. Chairman Hawk, you are recognized.
Thank you, Mr. Chair, but it's always difficult for this body to see so many well-intended folks who do have some differences. And ultimately, we are all looking for a forever home, for a home and a place where our loved ones can thrive. And I understand that there are some differences, and I appreciate the respect that each organization has with each other as we're having this discussion. So thank you very much. 2 questions, and I want to go down the road and who, I think I know who may be most qualified to answer this question, but if anyone wants to jump in, just throw your hand up and get the chairman's attention on this. First question is the number 4, as we're discussing the number 4 for individuals living within a home of the nature that we're discussing. Tell me where, of course, Tennessee is at that number of 4. Where are other states? And as we hear about Olmstead, does Olmstead tie us to that 4 individuals in a home type setting that we have discussed previously? And what are other states doing as well? And I'll throw that up, Mr. Chairman.
Yeah.
Recognized.
Hi, thank you very much for the question. And again, this is, we had a necessary course correction, right? The entire nation understood where we were at 20 and 30 years ago was not okay. Those are horrific abuses we never want to go back to. Olmstead actually is not about the building. Olmstead is about choice. And that is actually what we're asking today is choice. What we know since then, we needed a number. We didn't have enough data. Nobody was doing HCBS yet. So we just had to pick numbers, right? 4 sounds good, but we now know that there are instances of abuse in parent homes. There are instances of abuse in group homes. These numbers weren't enough. We needed something more multidimensional. And that is where we came up with the different types of concepts. First, the quality of life concept, then self-determination. We're now moving into causal agent theory. And this type of progression is something we have learned through HCBS. It isn't about a number. Would you rather your child be sharing a bedroom with somebody in a house through HCBS funding that is chosen for them? Or would you rather them living with their own bedroom, their own bathroom, right, on this beautiful property in $1 million home? That's what we're asking you. To take that choice from them takes us back, right? Now we're saying people with disabilities need us to tell them where they can and cannot live. Nobody is making anybody move to these places. This is a choice.
I appreciate that. And I appreciate you, Representative Hawk. It is absolutely possible to have differences of opinions. And everyone who I know who works in this field and who has a son or a daughter wants the very best thing to happen for folks. And there's a lot of different ways to get there. That is absolutely true. The number of 4 is not a magic number. That is absolutely correct, right? But a limit on the size of a facility that somebody lives in is absolutely necessary, but not sufficient to have a choice in life, to have self-determination. It is a lot easier to find a couple of people you're willing to live with than it is to find 7 other people that you're willing to live with and that you can share and preferences and activities with. As Roddy mentioned, oftentimes there's one staff person for 8 folks. You know what that means? It means that if somebody wants to go to the grocery store, there's a very good chance that 7 other people have to go along, right? It's really, so the number isn't magic. It is necessary to, when folks worked on it, it was really talking about what is family sized. Do you know, what are the natural patterns in a community, and where does somebody have, the most choice? I don't think that any of us have a problem with the city or the country or having a beautiful campus to live on, but it really is, you can't, it's about how you can have those natural patterns in life. And it's also about this kind of standards that make sure that we don't open up the door to other actors who aren't going to be so good. I can promise you that the institutions that got started weren't started to do bad things. Not the private ones that were smaller at 64 beds, not the large ones like Green Valley. Green Valley was a great place for a long time, right? But it's not. We also have learned, and we have learned that people with disabilities have needs and preferences. Not being able to speak doesn't mean you don't have anything to say. It doesn't mean that you don't know what you want, right? And the way to get your needs and preferences met is generally in smaller settings where you have more opportunity to exercise those preferences and don't have to take into account, what the staff person and the 7 or 10 or 12 other people are going to do, So I think that's really important. Sorry, Roddy.
Thank you. Chairman Hawk?
Not to change direction too quickly on us, but sometimes my mind goes beyond where we are at this moment, and I'm seeing an affordable housing concern with families coming our way. And for the folks at the panel, I'll ask the question, as we're looking at affordable housing, how does this particular piece of legislation affect that issue? And again, if you'll catch the chairman's attention and get your attention if you'd like to answer that question. I'm done. Thank you, Mr. Chair.
All right, you're recognized.
Thank you. This isn't affordable. This is tens of thousands of dollars a year that the majority of Tennesseans can't afford. I make a good living for Tennessee. I could not afford this, and I make 6 figures. But on top of that, you still have to pay for therapy. You still have to pay for transportation in the case of Brightstone, to get to therapy, to get to work, and everywhere else, on top of the tens of thousands of dollars for the house with 8 roommates that they want.
You
So-
recognize?
I will say, affordable housing is a huge issue for people with and without disabilities. Absolutely. Interestingly enough, there is a model here in Nashville called Our Place Nashville that has kind of tried to hit on affordability for both people with disabilities and those without. They are getting ready to open their 5th home, and those homes are shared by a handful of people with disabilities and a handful of people without disabilities, right? And it is, they're working with an affordable housing provider to build those homes. They actually don't need a license at all because they're not providing services. They're providing housing to people with intellectual and developmental disabilities and to poor people in town who need a place to live as well. They've opened up 55 units of affordable housing in Nashville over the last 5 years and are planning to do more. So there are really innovative ways to kind of try to address both, of the affordable housing crisis that we are facing in our state broadly, as well as for folks with disabilities.
Thank you, Mr. Carnes.
Yeah, thank you, Chairman. We've been very fortunate to have great support from the community. And as such, the community has supported many scholarships for our adults and will continue to help supplement all of those adults into the housing. So there's different paths to achieve affordable housing, and we feel like we have that solution for you.
Thank you. Okay, next on our list is Representative Bain.
Thank you, Mr. Chairman. So a bit of my background, I am a social worker and I received a disability studies portfolio certificate from the Texas Center for Disability Studies. I interned at the ARC of Texas and have worked with families with kids with autism for the better part of my 20s. So disability justice is a very close issue to my heart. And what disability justice, the movement, has tried to do over decades is sought to level the playing field for folks with disabilities across all socioeconomic statuses, especially considering people with disabilities face higher levels of poverty. They're more likely unable to pay their bills. And I understand that you all are in search of a solution for the problem, and I know you're well-intentioned. But what it feels like is a group of very wealthy families from Williamson County came together, wanted to buy $1 million property, and are trying to derail decades of disability justice policy to accommodate a few select families in Tennessee. So my question for you all is, what is the average tuition, normal tuition, unsubsidized tuition for your facility?
You're recognized.
So, thank you, Chairman. So the tuition is going to also depend on the scope of each of the individual housing, depending on whether you have 4 or 6 or 8, and that will depend on the where these adults are on the spectrum. But I will tell you, Representative, that this has been a community project. This isn't just a small group of wealthy parents who've come together and put this together. Also on the campus is a day program that will ultimately supplement 80 adults with IDD. But this has also been a charitable giving from so many families who want to support this and give of this. And I just want to break the notion that this is just a few wealthy families coming together and putting houses up. This is much on a much broader scale than that, and it provides a solution that we don't have in Tennessee. And this is a great option. And all we're asking for is a pilot program and give us a shot at it.
Representative Bain.
I hear you, but also Williamson County is the wealthiest county in Tennessee. And a lot of disability folks across the state don't have the privilege to hire lobbyists to be up here every day when they are juggling 2 to 3 jobs and trying to maintain. I just also want to acknowledge that the Senate sponsor of this bill is on your board, which gives you a lot more access, I think, than a lot of other organizations and communities who represent people with disabilities. Thank you.
Representative Mitchell, you're recognized.
Yeah, thank you, Mr. Chairman. Director Westlake, I've known you since the late 80s, early 90s, so I respect your opinion. The consent decree, is it still valid?
You're recognized. T- Microphone, please.
I'm sorry. Yeah. I think that the consent decree, which was for Clover Bottom and Green Valley, has been fulfilled at this point.
Okay.
You're
And
recognized.
thank you, Mr. Chairman. And I know the 4 is not a magic number for the folks with disabilities, but is the 4, would you say, is a magic financial number? Or the 8 is a more magical financial number for the other folks?
I think that really depends. I know a lot of people with intellectual and developmental disabilities who are living 2 folks in an apartment with supports. I know folks who are living 3, which is why I say 4 is not the magic number. I think when you get much larger, it's not magic because you can't say, oh, as long as it's 4 people, it's going to be fine. I guess that was my point. I mean, you can run a good or a bad program anywhere, but there are standards. There are national standards. There are measures that people use, and the size of the program is one of those measures because it really makes a difference about the quality of people's lives.
You're recognized.
Yeah. And Mr. Redden, I'm showing my age. I've probably known you for the same number of years, and the work you've done in my hometown over the years has been amazing. Your program is the gold standard in this state, if not in the country. The folks that you work with on a day in, day out basis, what is the living situation you're seeing with the folks in the rural areas?
Housing is a challenge everywhere, I think, but sometimes we've been able to work with the housing authority to help people find affordable homes. We don't operate any home with more than 3 people. 4 for us is too many. And financially, it works better sometimes with fewer people. The main thing, though, is community scale. You want to be able to go into a neighborhood and look like the other houses in the neighborhood. You don't want to build large houses that stand out. That's not community.
You're recognized.
Yeah, and for you guys, the farm in Franklin, that I know it's troublesome to some of my other colleagues. That's not as troublesome to me as, we keep saying pilot project, but it seems like it's a multifaceted pilot project, one in Franklin. Then we have this little situation in Memphis that gives me great pause. So, that's where I think, the 4 and 8 doesn't fit Kirby Pine's financial model. And I'm not trying to make a decision on Kirby Pine's financial model. I really don't care about their financial model. I'm more concerned about these Tennesseans that we're responsible for, not only their parents, but people in this committee. We should all feel responsible for them. So give me some reassurance that I'm not making a decision on the bottom line of Kirby Pines.
Hi. Thank you so much for that question. And it definitely is a distinction there. And so the homes at Brightstone, they are 7 bedrooms, 6.5 bedroom, 6.5 bath homes. So those are not going to have 8 people living in them. What you're talking about, it is on the Kirby Pines, on the Gloriana side, right? Now, that is something we haven't heard about a lot of. Brightstone, certainly, they've been here and they've been fighting for this. So we've heard a lot about them. I was so taken aback when I heard about Gloriana. This is something that I think nationally can really benefit Tennessee and show like we are solving a problem. This can be a model that can be replicated. It is intergenerational, interability. I am a parent of a very high acuity child. She's not a child. She's 20 now. We are on ECF. And there's a resolution that's going to be number 7th, I think, on the list today for the caregiver. And I hope that that passes too, because I am a parent caregiver who cannot receive services through ECF Choices. But what if 60 years from now, after spending all of this time taking care of my daughter, there's this end of life separation because I now have Alzheimer's or I now can't take care of her. And after 60 or 80 years of us together, we have to be separated. It is heartbreaking. There is a documentary called Mimi and Donna that highlights the reality of that all across the country of parents facing it. It is our worst nightmare. So 8 people, this would be 4 Jack and Jill style pods. So it's really 4 little units. So my daughter and me. And when Ms. Westlake said that she couldn't think of 7 people, we have. So myself and my friend Rachel and my friend Lee and my friend Stevie and each of our very high acuity children 40 years from now could all stay together. And we can socialize together and our kids can socialize together. It is a beautiful model that I really would love for everyone to be able to get to know more about.
You recognize?
If I may bolt on to that, I think the other thing I would want to add to this, Representative, is that we can get caught up in 4, 6, or 8. It's really at the end of the day that what we want to focus on and what we have now in the bill is with our quality standards that we are going to live by. And that is what gives you that assurance that you need that these adults are going to be really well taken care of. And also following DID regulations and licensure to boot.
Representative, you're good? Okay. Representative, Chairman Clemens?
Thank you, Mr. Chairman. I guess I have several questions. We talked about what's going well and the progress we've seen over the past few years, thanks to the advocacy of a lot of people and leadership of organizations. What has changed in the past few years that is necessitating this right now? What's new?
I think really what the bill really stipulates is that this would allow us to have homes within 500 yards of each other. That's, I think, really the main piece of what this pilot program would allow us to do. And in doing that, you're still advocating for community as part of all of that. But what it does is allow us to leverage the resources to better take care of these adults in these homes.
Well, I understand. I've read the bill. I know what it does. I guess I'm more concerned about what has changed in that requires this type of thing. And I also want to take issue with the pilot program notion of this. There's a section in here that makes this permanent on a set date, which is very unusual for a bill creating a pilot program. Generally, you have pilot programs to see how they go, see what happens, look at some data and some evidence. And then if we want to make them permanent, we come back with a separate bill and make it permanent. But this codifies a permanence date. So we can call it whatever we want, but this isn't a pilot program. Also, who can explain to me why the requirements for West Tennessee are different than Middle Tennessee?
You recognize?
So I will say, in terms of the in terms of the bill, as you're well aware of too, it has checkpoints all along the way. I think that should give you that assurance. And I think what we have is really, you know, you have these overarching assurances in both of these properties, but you're just coming at it in two different ways. And one is coming, from an adult living community, and another one is coming from a different community in Middle Tennessee.
So what I hear you saying is we're designing an entire bill around two specific companies and they're given business models. And therefore we're creating two different set of requirements for the same population just because they're on different sides of the Tennessee River. Help me get my head around that.
You recognize.
Hi, Representative Clemens, and I certainly appreciate the question. The way that I am seeing this, to answer the first question you have of what's changed, is I think that time, we've had anywhere, depending on where you start the starting point, we've had 17 to 25 years to figure this out. And the bottom line is, if all Tennesseans were happy with the menu of services that are being offered by the state, that these models wouldn't be in existence, right? Because they would be getting that through government funding, through ECF or whatever options we have. These two 501c3 organizations, which are funded by our citizens donating their hard-earned dollars into something good, decided to create these two programs that are solving a problem. They're not, the end-all be-all solution. We still have a lot of work to do as policymakers and advocates to resolve the issues we have in Tennessee. This is a gift to us through these 501c3 organizations, but our old, outdated codes that have not been updated with the new information we have now on national standards and how do we determine quality of life and how do we determine self-determination, we now have measurement tools for that. We just need this updated so that these two gifts can operate. And then we would really love, this isn't them, I would really love, if you want to explore opening this down the road next year, I'm happy to sit with you to open that to more. But these two programs have their funding, they are ready to go. But our old outdated code of 4 and 500 yards is preventing that when it makes no sense and no difference to somebody's actual quality of life.
You're recognized.
Thank you, Mr. Chairman. So you raised an interesting point about people aren't happy with the current situation. And so it gets me back to a comment that was made by this gentleman a moment ago with regards to choice. We talk a lot about choice up here in any given context. My curiosity here is the people I'm concerned about are the individuals who are going to be living in these homes. Do they have the choice or do their parents have the choice? Because I listened to Director Westlake talk about the difficulty of living with strangers, which is very real and it's very challenging. And you've got provisions in here allowing you to stack 2 people per room. I mean, this is a 2-person per bedroom, 140 square foot each. Do they have a choice in that matter, or do only the parents have the choice?
Yeah, if I may speak.
You recognize.
Each situation is going to be very different, Representative, and I appreciate your question. In some cases, the adults will have a choice, and in some cases, you have, like my son, who is an adult, a 26-year-old male who is nonverbal. And so what you do to the very best of your ability as a parent, and we do this at Brightstone, is really try to match up the right adults with each other that will fit best in that particular home, which is no different than some of the other homes all around the country. In terms of individual choice, and this is where some of these national standards come in play, and they look at that in terms of choice for that individual, down to, are they given the choice of 2 cereals? Can they pick the one cereal that they want to eat and so forth? And those are the things that will be looked at, in some of these standards that are already in place in the bill. So the answer is it really depends. And that's what you have with this broad spectrum of community. And as it comes down to choice for parents, we're getting calls from hundreds of parents who are asking for this and begging for this and at Brightstone. And we just want the opportunity to provide this with no state funding, no federal funding, and be able to do something that is really marvelous for the lives of these adults.
Chairman Clemens?
Thank you, Mr. Chairman. I guess I still fail to see why it can't be done under existing law. I mean, it just, I guess the answer I'm hearing is it doesn't fit the business model. It doesn't have your particular existing property. And it seems like you're designing this around you rather than the needs of the individuals. That's my concern. So thank you, Mr. Chairman. That's all I have for now.
Thank you. Chairman Kumar, you're recognized.
Thank you, Mr. Chairman. Thank you for your testimony. It has been very good, and that makes life difficult for us in the sense that it would be helpful if you could summarize in 2 points or 3 points for either side that says this is why your model is better. It seems to me, depending on who's providing the care and what love and nurturing they offer, these residents can be cared for very well in either situation. But to differentiate it, could you kindly summarize it, as I said, in 2 or 3 points, why one model is better than the other? I would really appreciate it. It would help us, for those of us who, well, most of us came here with an idea in mind about how we feel about it, but you have done a very good job of offering so many points that have sort of confused me. Kindly. Thank you, Mr. Chairman.
Thank you.
I can go.
All right, you're recognized.
Yeah, I'm happy to speak to that. I think that Representative Clemens kind of really said it just a moment ago, which is we're not proposing a model of any variety. We are trying to defend our state's rights and responsibilities to protect the rights of people with disabilities. And we have a standard in the code for doing that. We have licensure laws, we have rules and regulations that work and have worked. They're not an old model. They are constantly evolving. The standards that are referred to in this pilot are also the standards that are used broadly in the system for the thousands of people that are served and that this state has responsibility for. And I think our biggest concern is that if you start carving out exceptions to the state's licensure standards for one group or another, because you can, then you open up the door to bad actors as well as good actors, right? If you say the standards and the licensure laws don't really count, and that people ought to get exceptions to them, you've opened the door, and it can potentially be a Pandora's box. And the people who suffer are people with intellectual and developmental disabilities. You know, we can talk a lot about policy, we can talk a lot about rules, we can talk a lot about models. At the end of the day, this is about people with intellectual and developmental disabilities who are worthy of being in the community and who can make choices for themselves and need to be allowed to do that. Thank you.
You're recognized. You're recognized.
Yeah, in 2 or 3 points, I would say the following. I would tell you overwhelmingly, the community is asking for this. We hear it, and your constituents are, really want to see this fly, so that they can provide a choice for them and for their son or daughter to have a place to be as an aging parent, and and at the inevitable when they pass away, where else are they going to go? Number 2, I would tell you that we provide choice and community for these adults, and ultimately, this whole thing has all the guardrails put in place for the safekeeping of these adults. And this is a bottom line. This is a dream come true for so many of these adults.
Chairman Kumar?
Thank you. Second question, I I guess you'll tell me if it is relevant or not. Among the residents who are under your care, are some of them able to perform any occupational work within their abilities? And would that serve these residents better in a 4 people resident or more? And how does that play?
You're recognized.
Thank you. Absolutely. We have both members of our day program and residents who work in the community. Each of the homes has a van. We provide a van and transportation for each of these homes, which allows that flexibility into the community. They not only work in the community, they participate in the community where they grocery shop, they attend different activities and enjoy the restaurants, and they are now able to live the life that they could only have imagined for themselves. So I'm really appreciative that you asked that question.
Thank you.
Oh, thank you. Chairman Whitson, you recognize?
Thank you, Chairman, and thank you all for being here today. First, before I make a comment, I just want to say I fully support the position of Director Westlake. We worked together for years on some incredible projects, starting with Katie Beckett. You've been a trusted advisor, and when you talk about family size being manageable, safer, I fully agree with you on that in this regard. But also, let me just say this. I live in Williamson County. Brightstone is in my district. It's a great facility. Their day program is outstanding. It has nothing to do with wealth. I'm not a wealthy person. I live in Williamson County, but I do have a granddaughter with Down syndrome, and that's given me a great perspective on things. But Director Westlake, I fully agree with you, and I support your position. My question, and I don't know anything about Kirby Pines, and for the gentleman from Brightstone, I just want to make sure I heard correctly. Under this pilot program, Brightstone would be a ratio of 4-to-1 and Kirby Pines 8-to-1. Did I hear that correctly?
Right now, the way the bill is set up, it is to have no more than 8 for either community. From the Brightstone perspective, we're going to look at what is in the best interest of the individual, and determine whether, what that right number needs to be, whether it be 4 or 6 or something else.
You're recognized.
And, again, that kind of brings the question too, where is the Department, DIDS, Department of Developmental Disabilities? What do they recommend? What is their ratio? Have they done a task force to look at this?
I have the answer to that, actually. So currently, the ratio for the resident, which is it makes me question, like, what are we doing? Because the ratio through DIDD is 1-to-10. That is what the state licensure requirements are, is 1-to-10. But we're arguing about, 4 maximum. Ratio and residential capacity are different. Those are 2 different things that we're talking about. So ratio, as far as the staffing, is based on the individual support plan, which is written into this bill. But the capacity, the 4 or the 8, is how many people will be living. That isn't necessarily how many staff there will be. But the ratio for DIDD for this setting is 1-to-10, and they're going to be under that. But why is there 10 if all we could ever do is 4? I don't know the answer to that.
And I would like to ask Director Westlake that question also.
Yeah, if I can defer to Donald Redden, I would like to do that,
Okay.
Representative, because he works with DIDD licensure on a daily basis and understands it better than I do.
I don't know that I understand it, but
Could you move a little closer to the microphone? I don't.
sir, the 1-to-10 is the minimum standard that is in licensure. However, the funding through DIDD specifies what the ratio should be. It may be 1-to-1. In some cases, it's 2-to-1. It usually, with day services, it's 1-to-3. So it depends on the funding level, but there's nothing that's 1-to-10. That's only in the minimum standards that we see in the licensure law.
And
Director Wesley?
and that really is, you know, just to clarify, ratio is if people need support services from a direct support professional, how many paid staff persons are required for folks. And there's a minimum standard, but it is as both folks have said, individually determined, whether that's a day program, whether that's residential, whether that's whatever it is. The size of a residential license, the department can only license any new facility for 4 beds or less, and that has been true for a long time. There are some larger group homes in our state that were grandfathered in the. I'm looking at Donald and figure it's been a while ago, probably 20 years ago. Yeah.
Chairman Woodson, you're
Again,
recognized.
just to reiterate, again, my position is I have concerns about the pilot program, but I just want to make sure people understand Brightstone was not started by a group of wealthy folks. It was done by folks with good intentions to help the disability community.
Chairman Hicks, you're recognized.
Thank you, Mr. Chairman. Thank y'all for being here. Been great conversations, and thanks a lot. I want to try to get my brain wrapped around exactly options. In the world that we live in today, and it's a changing world, and trying to move forward, what options, if I'm a aging parent and I have worked hard all my life, worked hard all my life, and I have an adult child with a disability, okay, and I see what's coming, okay, what options do I have for my son or daughter to move forward for them to live the rest of their life? I need to know that.
So I will.
You're recognized.
So this body, the General Assembly, over the last maybe 10 years or so, has passed 2 pieces of legislation that require that an aging caregiver for folks with intellectual disabilities, if there's an aging caregiver 75 or older, there is a path into Medicaid waiver services in order to begin to provide those services and supports. And there's a subsequent bill that for aging caregivers 80 years and older, you know, for folks with developmental disabilities, there is a path to Medicaid waiver services so that they can get supports and services they need. Are those supports and services office perfect? They are not. I think one of the reasons that we are here today is because we do have some really challenging issues around what people's options are. There are options, they're not great options, right? You can get in, but we have a workforce problem. We have affordable housing problem. We have a bunch of things that we've talked about. We do need to do better for this population. I think we can do that within the constraints of our current licensure. So there are programs in Medicaid waivers. There are programs like Our Place Nashville, for example, where most of the folks who are living there that I described earlier have aging parents and they have moved into permanent housing in the community with others. There are things that can be done. There's not enough of it. Absolutely. We need to do better.
Chairman Hicks, you good? Oh, you're good.
Thank you.
You're recognized.
I'm glad you asked that question. When you're a parent of an adult with disabilities, you get to know many other parents of adults with disabilities as well, where it's like you're a community. So I can tell you exactly what those other parents are doing. They are stuck. They are looking for options outside of the state, and they're trying to navigate some very difficult choices. And we are now bringing a solution to the table for Tennessee and Middle Tennessee.
Thank you, Mr. Chairman. And moving forward, I mean, I just feel like this is a common sense, innovative approach in the world that we live in today, trying to move forward. We're getting more and more people in this state. When we have more and more people, we're going to have more and more folks with disabilities. And I think this being a pilot program This is a great option, and I will be supporting this bill. Thank you.
Right.
Thank you.
Thank you. And that brings us to the end of our list of questioners, except for me. I do have one question for you, and this goes to, you brought something up, and it goes to the way the bill is written, and each building may house no more than 8 individuals with intellectual and developmental disabilities. But nowhere in here that I can tell, you brought up that some of these individuals may need one-on-one care. They may need 1 to 2 care. I know that as a physician at the hospital, when we have a patient come out in the recovery room, it's 1-to-1 care. Sometimes as the patient gets stabilized, it's 1 to 2. In the ICU, it may be up to 1 to 3. When you get to the floor, patients on the floor, it may be 1 to 6, 1 to 8. What assurances do we have that it's not going to be 1 to 8 in each building? And because that's what this says, and we'd like to take it that your business model would look at the patient or look at the resident, but what assurances can you give us about that?
Thank you, Chairman Terry, and I appreciate that. I can tell you that we were we had conversations with the coalition and the council and myself, and then we went back to Brightstone. They were very amenable to every recommendation we had. And so that is why we have the amendments today. The national standards are in there for Tennessee. DIDD is already using this in our HCBS programs, is the personal outcome measures through CQL. That will be one way. The residents themselves, through those types of national standard metrics, are going to be able to ensure that we know that they are protected, as well as these are not members that are segregated or isolated. They have constant contact with their families, with the community. They are out in the community working at jobs, and the community comes to them, which is something that does not occur in CLS, right? The community comes to them as well. And so we don't really have any concerns over there being any leeway to deviate from the intended plan, because there's so much oversight built into this through the licensure compliance as well as the quality assurance.
All right. Thank you. And I believe Representative Travis had one more question.
Thank you, Mr. Chairman. And this is really not a question. This is more of a statement from a grandfather who has a disabled child. For you guys to be here and look for the future of these children is pretty big. And I appreciate you doing that. And today I will be a yes for this bill. So I appreciate you guys coming today.
Thank you, Representative.
All right. Thank you. And I appreciate the discussion from our members and from the panel. Thank you guys for coming talking. It's been very informative. So without objection, we will go back into session. Representative Hurt, the floor is yours.
Thank you, Mr. Chairman, and I do appreciate all the questions, all the input from our guest. And I've said this many times over the last couple of weeks. It's with every person I've talked to, on which side they be on this bill, I don't know that I've ever dealt with anything with anybody that had more good intentions from both sides and the concern they had. And I appreciate that. I wanted to take a second and make some comments over some of what I heard. The affordable housing situation was mentioned, and that's a problem. We know it's a problem, not only with these individuals, but across the board. This is not the solution. This is an option. This is a private pay option. Nobody's forcing an individual to go. I've talked to many parents over the last couple of weeks, and the ones that come in and have the concerns, I'm going, yes, I agree with that. Maybe that's not the place for your child. Ask your child and make that decision between you and your child. This is not forcing anyone to put an individual there. This is again a private pay option. So, we're not solving the problem. We're just giving choices. We hear that line of 4. I think lines limit opportunities, and we're at the point that we can start testing that and giving more options to these individuals, because they're not there in the state of Tennessee. There have been some steps, But I want to go to my colleague from Davidson County. He had two questions that were very good, and I've contemplated both of them. You said, what has changed? And they addressed it a little bit, but what I'll say to that is the need has outpaced the solutions. And the solutions are coming, but because of the limitations, they're slower. And the need is growing. So there are solutions. We're just not meeting the need at this point in the state of Tennessee. I say that to say that it was also asked if this could be defined by the feds as an institution. If that's the case, I don't think so, because I've got a list here of roughly 31 different places that are offering these solutions in about 14 different states, more than 4, most more than 8. And they are providing solutions. We heard from a parent that I've had to look outside of the state of Tennessee. We're behind. We can take some controlled steps to find solutions for these individuals. And the last thing I'll kind of say here is for each student, I think this was to your question, Mr. Chairman, and it was touched on. Each individual has an individualized support plan. They are addressed individually for their need. They aren't just put in a room and left. They are taken care of based on that plan. So I wanted to kind of I know it was mentioned, but I wanted to mention that too, because, great concerns across the board on this, but members, I just ask that we provide options, and this is a controlled step to start looking at those options. With that, Mr. Chairman, I'll take questions.
All right, thank you. We've got a list of folks here. Chairman Faison, you're recognized.
Thank you, Mr. Chair. Committee, Mr. Chair, for the last 16 years of my life, before I got into politics, I've been on the board of directors for a provider of my friends that are in the DIDS community. One of the greatest times I have ever is when I go to our group home. There's 20, 25 at this group facility that I go to. They don't care if I'm in politics. They just love me. I get 25 hugs. Hey, I take my guitar sometimes. I play music with them, and the interaction I have is some of the best human interaction I have ever. It is a pure joy for me. I have a great love and respect for the individuals that we're talking about right now. I also understand some of the history after being there for 16 years. I have friends that I could speak of that still to this day that have PTSD from institutionalized living. And they could, if you heard their stories, it would wreck you of what took place in institutionalized living. As I've looked at this bill and studied it, this is not what used to be. This is not what my little friend that has PTSD from what happened to her is about. I would also like to remind you when I say that unfortunately, there are still problems in the current model that we have. I don't want the committee to think that this model that we're currently under 4 or less is somehow devoid of issues and abuse. I would love to brag and say that our DIDS community is rid of abuse and neglect in this community because of the current model we have. That doesn't exist. It would be a beautiful thing if it did, but it doesn't. But this bill, I think, which is important, offers a family the ability to figure out what's best for them. And one thing, it's been missed all day, and thank you for everybody who testified on all sides. I love each one of y'all. The community that I serve and that I have the pleasure of working with, we don't need to negate the fact that they have their own ability to make decisions with their family. They know who I am every time I walk in. They know who their family is. They know the people who come and work in that community. They know them by name. They make decisions for themselves. By and large, they can completely self-contained and take care of themselves and are very aware. Hey, I dare say that they can pick out a bad person before you can. They have a sense of people when they walk in, whether they want to shake their hand and give them a hug or not, they're incredibly brilliant, and the Lord has blessed them and they're special. And so I would just want to encourage the committee to look at this from a way that, and I loved Representative Hurt said, nobody's forcing, and for those of y'all on my left side, I get where you're coming from. Nobody, this bill doesn't require anybody that you love or care for to go into one of these places or facilities. Hey, and 100% stand with you and your decision to keep them at your home or to keep these people in the facilities of 4 less. I'm with you 100%. But then also I realize there's other individuals like, I want something different. And committee, that you're talking about people have the wherewithal, the means to make a decision with their child, with their mom, with whoever it is, what's best for them. And I feel like it's not right for us as a state to say, nope, you're stuck at only 4. You can't try this other facility. And I will tell you all this and tell everybody, if this bill does get passed and we see that problems persist, do not think for 1 minute that the state won't intervene and come back and say, oh no, we won't do this. We have made mistakes over the years. Believe it or not, politicians make mistakes over the last 200 years that we've been here. We can undo that. But I believe this is an opportunity to show Tennesseans there is other options and put this in the hands of those who love the most wonderful people in our community, in the DITS community that I love, and give them a shot. So thank you, Mr. Chair.
Thank you. Good. Next on our list, Chairman Boyd.
Thank you, Mr. Chairman, and sponsor, appreciate you bringing this. And I didn't know much about this a couple of weeks ago, but there was a day last week where I think almost every person that came to see me in my office was stacked up on this issue. I mean, it was just a day of meetings on this, and I learned quite a bit about it. And I have found that, as Chairman Faison said, on both sides of this argument, people care deeply about Tennesseans with intellectual disabilities. But one of the things that I heard over and over again from people that objected to this legislation was that they didn't object to Brightstone. They said our fear is that this is going to get built and people are going to love it, and then it's going to want to spread. And I said, well, it can't. And they said, yeah, no, this is a pilot program, and you know how these pilot programs go. And I heard that over and over again. And I hate to agree so much with my colleague from Davidson County, who always asks me the tough questions, but I would agree with you. This says pilot program, but it really doesn't. I don't think it is a pilot program. I think what it is it's kind of we've opened the window and we're making an exception for some of these companies that have a strong track record and have a good product that they want to deliver, and it allows them to do that. Then it closes the door. And we're not necessarily, this is not the tip of the spear. It doesn't appear to me, looking at the legislation, that your intention is to, in a few years, to take us back to where we were in the past. This is to allow these companies to bring their product to market, and we have people that are lining up that want to use it. And so I just want to, from my reading of the bill, and I want you to kind of confirm this allows these two companies or these two developments that we're talking about to come to fruition, but it's not your intention for this to take us back to where we were years ago, is it?
You recognize?
Thank you, Mr. Chairman. And thank you for that. Absolutely not. My intent is to take a small controlled step and show that this can be done in Tennessee, and it can be done the right way, and we can offer opportunities the right way. I feel like the legislation is written there enough that we can take that step. I don't believe it's a step back. I think it's a new day. I think we've learned. I think it's a step forward, and I think it's a very controlled step forward to give individuals and families options.
Good. All right. Thank you. Next on our list, Chairman Jernigan.
Thank you. I have more of a statement than a question. And Chris, I respect you, our representative. I think that this is about a model. I think it's about a business model. I don't think it's about a choice for the individual with a disability. I say that because the choice it's about the parent's choice. The person with a disability doesn't have $75,000. They'll go where the parent tells them to go to. So then I think we're changing the law for a business model that's not consistent at one place and not consistent at another. And I do not think it's a pilot program. You don't build multi-million-dollar homes for a pilot program. So I said my piece in subcommittee about this. I'm being worn down, but I'm going to be a no and encourage my colleagues to do the same. Thank you.
Chairman Vaughn, you recognize. Representative Hurt, you recognize.
Thank you, Mr. Chairman. I'd just like to give a quick response. And again, I totally respect where you're coming from, Representative. And the only thing that's something else that I had on my notes from earlier that I skipped. We talk about choice, and I think my colleague from Davidson County mentioned that to the guest. I would question that if there's a parent that would not communicate with their child and they would force them to go there, even against their will, I would question what they're getting at home behind closed doors. So I think if we've got a situation like that, there are other circumstances than maybe if those parents are forcing that child to go there, there would be more discussion and more light brought to what was the care for the child. Because I would think if a loving, that there were most parents that I say are loving, but if they would force a child into a home like that there might be even more questions behind it, and it might be a good step for them to have this opportunity. So that's my only response.
Thank you. Chairman Vaughn.
Thank you, Mr. Chairman. And as I sit here, I'm much like Chairman Boyd. I haven't been involved in this, and I wasn't a part of the passionate goings on and debate, spirited debate in the subcommittee. But as I look at this and in hearing this today, I'm listening to people are asking for an opportunity to use private dollars to fund a market-driven solution to real needs in their communities. And when I say it's market-driven, it's because there are needs that are not being met by the current system. And so they're willing to make investments in order to try to meet these needs. And as I sit here and thinking about, I know that we as a government, we tend to be so protective of those who need protection. But sometimes we have to realize there are other people who can also protect these communities outside of us and may do a better job of it. And so I'm thinking we've got a situation here to where people are wanting to provide a product that people who have a need are going to fund themselves, and all we're being asked to do is get out of the way. And I'm really struggling with the fact that that it has boiled down in such a complicated world and such a complicated landscape that's what's happening. And then the last thing I'll point out is that I know there's been some conversations about the Williamson County organization. All I can do is speak to is the Kirby Pines group that is going to be involved with Gloriana if that is if this legislation passed. And they have built a model in my community of congregate care living for seniors. It takes it all the way from people investing and living in homes all the way up until their final days there, whatever basis of living assistance they need. It is a spectacular facility. And so for people to be concerned that one may not be as good as the other because it's got different ratios associated with it, I can tell this committee to calm those fears, because the product that these people first started at a facility in west of my district in Shelby County, and then they supplemented that with an additional facility in Collierville, and it is a spectacular piece of work. And so if you're concerned about the operators in this, I would encourage you, I would try to allay those fears, because I only know one of this group of operators, and that one, I believe, is capable of carrying this off. So thank you.
Thank you. Okay. Chairman Clemens.
Thank you, Mr. Chairman. And This has been one of the most interesting, and I haven't been intimately involved in this, go back and forth. And I know you've worked when you've drafted amendment after amendment, trying to work with everybody, and I really appreciate it. This is actually a really interesting issue, and I appreciate the spirit of your legislation. I appreciate your intent, and obviously this is something on which we should all be focused. And individuals with special needs and housing solutions should be a priority of this body. And I appreciate the fact that this healthy discussion is taking place. I have concerns about the legislation as drafted, as I pointed out, because I think we're codifying language around two specific businesses, which I think is very dangerous. Because I do not question the integrity or business reputation or motives of anyone. And in fact, all I've heard are good things. But there are bad actors out there. I appreciate market-driven solutions, but often profit-driven solutions becomes a higher priority than the people. And I think this is one of those real issues that we really need to study. I mean, you said it, need has outpaced the solution. Maybe that is true. And in fact, if the data supports that, then we need to spend some time really thinking through how to solve this within the law that exists. And let's have a conversation. Let's have a healthy debate about that and figure out how we're going to do that without codifying language just to fit two businesses' models. That's what concerns me the most here. And let's design the legislation around the people, not the businesses. And I don't think you're averse to that. I don't think anyone on this committee is opposed to that or disagrees with that. But that's all I would ask that we do, and approach this from a different perspective and a different angle rather than from a private business perspective, even though they're by all means respectable in every way and have the purest of intentions, as well as yourself. So, I just wish we would have a people-driven policy rather than a market-driven policy in this case. That's what concerns me the most. Thank you, Mr. Speaker. Mr. Chairman, I mean.
You're recognized.
Thank you, Mr. Chairman. And I appreciate those comments. I do think, I'll go back and reiterate, I do think this is a controlled step forward. I do, in all of my discussions with whatever group or whichever parent it is, I think this has sparked conversations that have been needed to be had more and more. And I think that's just going to grow. I do think they're outside of the line that's been drawn in Tennessee. This is occurring in other states and they are having success. There are wait lists, some as long as 4 years in some of these states and some of these homes. I feel like this is a step that we need to take now to show that we can do it in Tennessee, a small controlled step, while we have a bigger conversation with everyone involved and look what would be the next step when we show that this works. So that just made my only reply. Thank you, Mr. Chairman.
Thank you. Representative Travis, you're recognized. All right. Question has been called. All those in favor of House Bill 2497 as amended, say aye.
Aye.
Opposed?
No.
Ayes have it. Bill goes on to Finance, Ways and Means.
Thank you, Mr. Chair and committee.
All right, thank you, and appreciate everybody for their debate and for their patience. That brings us to item number 3, House Bill 1146. By Representative Vital, you are recognized. You have a motion and a second.
I want to see what the committee does.
Thank you, Mr. Chairman, members of the committee. Before we take any action, I'd like to address the committee and say that when I embarked on this legislation, it was about patient care. It was about creating additional pathways to provide quality healthcare professionals for patients across Tennessee during surgery. During this General Assembly, we have created many new pathways for many other occupations, and healthcare should be no different. Many of you have been willing to listen and talk with me during this process, and for that, I greatly appreciate it. I think we can all agree that patients deserve timely access to quality health care. However, there is a difference in opinion on how this is accomplished. I look forward to working with the members of this committee and continue this dialogue this summer. With that, Mr. Chairman, I would ask that House Bill 1146 be taken off notice. Thank you.
All right, without objection, House Bill 1146 is off notice. Thank you. That brings us to item number 4, House Bill 2376. You have a motion, a second. You are recognized.
Thank you, Mr. Chairman.
And we have an amendment that rewrites the bill.
That is correct, Mr. Chairman.
Okay. Amendment, drafting code 015674.
That is correct, Chairman.
Okay. You have a motion, a second. If there's no objection, let's go ahead and get that on the bill. All those in favor say aye. Opposed? Ayes have it. We're back on the bill as amended. You're recognized.
Thank you, Mr. Chairman. I do want to extend my gratitude for your assistance in this, and Chairman Hawk as well, in helping me get this legislation drafted as it is. And it's really just a small correction in the TCA code for home organizations, and just closes up a loophole. And with that, I'll stand for questions and renew my motion.
Okay. Any questions for the sponsor of the bill? All right, seeing none, we're going to vote on House Bill 2376 as amended. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to count and rules.
Thank you, committee.
All right, thank you. That brings us to item number 5, House Bill 282. Chairman Baum, you are recognized. You have a motion, a second. I believe you have an amendment that rewrites the bill. Is that correct?
Yes, it's 017275.
All right, I need a motion. You have a motion, a second. Since it rewrites the bill without objection, let's go ahead and vote on amendment 017275. All those in favor say aye. Aye. Opposed? Ayes have it. We're back on the bills amended. You're recognized.
Thank you, Chairman Terry. This is a bill designed to increase access to health care for our constituents and to provide that health care at lower cost to them, all at no cost, no additional cost to the state of Tennessee. It would do this by giving pharmacists the ability to issue and dispense tests and medications in 8 additional categories. And I'm going to tell you what these 8 categories are, but before I do, let me acknowledge that these are categories that are agreed upon by the Tennessee Pharmacists Association and TMA, Tennessee Medical Association. And these 8 areas are antivirals for influenza and COVID. Number 2, some immunizations. Number 3, medicines to prevent or control the spread of HIV. Number 4, hormonal contraceptives. Number 5, epinephrine. Category number 6 is naloxone. Category number 7 is topical fluoride agents. And category number 8 is TB and TB testing. Some of these areas you may think pharmacists currently have the ability to test or prescribe medications for. And in some of these cases, that is correct. That is true. But this has been passed by prior Tennessee legislation, but that legislation sunsets at the end of the 2024 calendar year. And so this will extend pharmacists' abilities in some of those areas. So to conclude, this bill will provide additional access to health care. 90% of all Tennesseans live within 5 miles of a pharmacist or a pharmacy. It will provide care with shorter wait times. A lot of people can walk into a pharmacy and receive this care without needing a 2 or 3 week wait for an appointment. Much of this care can occur after hours or on weekends, and it can be administered at lower cost. And so I stand ready for your questions.
All right. Any questions? All right. The question has been called. All those in favor of House Bill 282 as amended, say aye. Aye. Opposed? Ayes have it. Bill goes on to count and rules.
Thank you all.
All right. That brings us to your next bill, item number 6, House Bill 2866.
Yes, and this one also has an amendment.
Okay, I need a motion, a second on the bill. You have a motion, a second. All right, we have an amendment, drafting code 017331. Is that correct?
Yes.
Okay, we have a motion, a second on that. It rewrites the bill. So if there's no objection, let's go ahead and get that on the bill. All those in favor say aye. Opposed? Ayes have it. We're back on the bills amended. You're recognized.
Thank you, Chairman Terry. Members, this is a bill that would create a 3-year pilot program to help get more psychiatric nurses into our regional mental health institutes. It would do this by providing up to 5 students a year at MTSU with a $3,000 scholarship. And in return, or in exchange for that scholarship, these students would agree to practice or to provide services at a regional mental health institute for 2 years upon graduating, and to provide loan forgiveness to up to 15 students who, after completing 2 years of service at a regional mental health institute, they would be eligible for this loan forgiveness, conditional on them having completed their licensure requirements to become a clinical nurse specialist in psychiatric or mental health with the master's degree.
All right. Thank you. Any questions for the sponsor of the bill? All right. See, question has been called. Seeing none, we are voting on House Bill 2866 as amended. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to Finance, Ways and Means.
Thank you all.
Brings us to item number 7, Senate Joint Resolution 848. Representative Stevens, you have a motion second. You're recognized.
Thank you, Mr. Chairman. This is a Senate Joint Resolution. It urges the state to develop by January of 2025 a comprehensive statewide paid family caregiving policy and program in collaboration with consumer stakeholders and advocates to support family caregivers in the state.
All right. Any questions for the sponsor of the resolution? All right, seeing none, we are voting on Senate Joint Resolution 848. All those in favor say aye. Opposed? Ayes have it. Resolution goes on to calendar and rules.
Thank you.
Thank you. That brings us to item number 8, House Bill 1960. Representative Powell, you are recognized. You have a motion and a second. And there's an amendment, I believe, that rewrites the bill.
There is.
013823. All right, we have a
That's
motion and a
correct.
second. If there's no objection, let's go ahead and get that on the bill. All those in favor say aye. Opposed? Ayes have it. We're on the bill as amended. You're recognized.
Thank you, Mr. Chairman. This bill is amended, only applies to Nashville General Hospital and it does not apply to high deductibles. It would allow state employees to utilize Nashville General, and then Nashville General could work with insurers to waive both deductibles and copays. And we're hopeful this has been very successful as it applies to work that's taken place in the city of Nashville, working with city employees. It would be very effective as we have so many state employees here in this Middle Tennessee region. And with that, I also have two, Dr. Joseph Webb, the CEO of Nashville General Hospital, and Bruce Nairmore, the CFO of Nashville General Hospital. They're on the list to testify, but if anyone has any questions, but I know that we've heard a lot of testimony already. So.
All right, thank you. I think Chairman Jernigan
Yes,
has a
I
comment.
just wanted to say that I actually sat on the Metro Council when we passed this for Metro employees. And it was been an incredibly successful program. And as, well, at least as a few years ago, my district had the #2 state employees living here in Davidson County, and it would give them access to be able to use General Hospital and to have that copay waived as well. So it's an incredibly nice benefit for state employees when we're always trying to attract them. And I can testify that when we did it in Metro, that it was a very successful program there. So thank you.
All right, thank you. Any further questions for the sponsor? All right, question has been called. All those in favor of House Bill 1960 as amended, say aye. Aye. Opposed? Ayes have it. Bill goes on to state government.
Mr. Chairman, I know I've got a second bill too. If I could, you brought this up at the beginning of committee. If I could share just with Representative Matheny.
Oh, absolutely.
Yeah, I was fortunate enough to serve with him too. And the one thing I always remember with him is he would always have one of those strength grips that he was pumping constantly. And I didn't know why he was doing that. And it was like, man, are you just trying to have the strongest grip in the world, or what's the deal? And truly, he said, I just don't want to let anything here bother me. And so, I thought that was very special. And I remember that because, oftentimes I try to live by the same principles he did. Is what happens up here, he would just leave it and walk away from it. And you talk to him outside of here, and we had a lot of differences. He was just the nicest and calmest guy and just a true gentleman. So Just want to mention that because every time I think of Representative Matheny, I think of that. So thank you.
Thank you for those words. I appreciate that. We go to item number 9, House Bill 1962. Need a motion. Motion a second. So you are recognized.
Thank you. And let's see, we also have an amendment on this.
We have an amendment, drafting code 015394. Okay, you have a motion, a second. So let's go ahead and it rewrites the bill. There's no objection. All those in favor say aye. Opposed? Ayes have it. We're on the bills amended. You're recognized.
So this bill is amended would simply have a requirement, the Department of Human Services to conduct a cost estimation model around childcare in addition to the current rate-based model that they use. And then they would report that information back to us and we could decide which model we wanted to adopt, but it would give us a better understanding of the true cost of childcare in Tennessee.
All right. Thank you. Any questions for the sponsor of the bill? All right. Seeing none, we're going to vote on House Bill 1962 as amended. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to Finance, Ways and Means.
Thank you, Mr. Chairman, Committee.
Thank you. We have disposed of items number 10 and 11. I don't see McKenzie in here. Okay. All right. Item number 12, we will roll House Bill 2406 to the heel. That brings us to item number 13, House Bill 1975 by Chairman Hawk. You are recognized. You got a motion, a second.
Thank you, Chairman and members. This is a bill that focuses on TANF and really all 4 tenets of TANF to ensure that we have a nice, robust description of what we're doing with the investments in specifically fatherhood issues. As we look to strengthen our families across the state of Tennessee, this is becoming more and more important to have a strong father figure. And this is going to tell us how we're going to ensure that families are staying in their children's lives. With that description, Chairman and members, that's what the bill does. Thank you.
All right, thank you. Do we have any questions for the sponsor of the bill? All right, seeing none, we're going to vote on House Bill 1975. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to counter and rules. All right, that brings us item number 14, Chairman Farmer on House Bill 1825. You have a motion, a second. You are recognized.
Yeah, thank you, Mr. Chair. And this bill was double referred here to your committee. So do we need to adopt House Amendment 15567?
It's traveling with the bill.
It's traveling with members. And thank you, Mr. Chair. What this bill does, it raises the amount of pseudoephedrine that we can buy. That's a major component in a lot of our cold medicine. What it does is raises it from 5.7-ish grams per month to 7.2 grams. What that means is you could buy a complete total of 2 boxes per month. And we're raising the yearly amount up from 28.8 grams to 43.2 grams. So with that, Mr. Chair, be happy to have any questions from any members. Thank you.
Do we have any questions for sponsor bill? Chairman Hawk, you recognize.
Thank you, Mr. Chairman and members, and thank you, Chairman Farmer, for bringing this. I'm the bad guy that actually passed the original legislation that limited the amount of Sudafed that individuals could buy. So I apologize for the last decade of folks who have been sneezing all spring long. That's my fault. So I own that. In the rational basis, and just for folks to remember where we were a decade ago, the meth labs that were killing people in our communities, that were blowing up homes and blowing up cars, and the meth labs that were there and so unfortunately prevalent on the news on a daily basis in all of our communities. That's why we did that at that point in time. Unfortunately, it is still a problem, a major problem out there. Meth is still a major problem out there, but it's coming from a different source now. And it's still an extremely frustrating problem. But this piece of legislation helps us realize that this particular product is not part of the problem now. So I appreciate you bringing this legislation. I think it's moving in the right direction. Thank you, Chairman.
Chairman Farmer, you recognize.
And thank you, Mr. Chair, and Representative Hawk, I remember I was on that committee. I think I was in my maybe third year, and I remember Chairman Shipley had carried around the little box there to show how much that would be. So thank you for that.
All right, seeing no further questions for the sponsor of the bill, we're going to vote on House Bill 1825. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to calendar and rules. That brings us to item number 15, House Bill 2011 by Chairman Vaughn. You are recognized.
Thank
I
you,
need a motion.
Mr. Chairman.
You have a motion, a second. I believe you have an amendment that
Motion on the amendment.
rewrites the bill. Is that correct?
Yes, sir, it does.
Drafting
and
code 015883.
It is indeed.
All right. I need a motion second on that.
Motion.
Motion second. Okay. It rewrites the bill. If there's no objection, let's go ahead and get that on the bill. All those in favor say aye.
Aye.
Opposed? Ayes have it. On the bill's amended, you're recognized.
Thank you, Mr. Chairman. This bill deals with electronic medical records, and it prohibits a covered entity from entering into a contract with a person or entity that includes terms that restrict a patient or the patient's representative from accessing the patient's electronic health records. It clarifies it's an unlawful restraint of trade for a person to intentionally violate federal laws regarding information blocking. There's also a section in the bill that says that test results, electronic health records must be held 72 hours after certain test results so that they don't, they're not published prior to the doctor having to be able to speak personally with the person with the test results. So that's this bill.
All right. Thank you. Do we have any questions for the sponsor of the bill? All right. Seeing none, we're going to vote on House Bill 2011 as amended. All those in favor say aye.
Aye.
Opposed? Ayes have it. Bill goes on to government operations. All right. That brings us to item number 16, House Bill 2093. You have a motion and a second. Chairman Vaughn, you are recognized, and I believe this bill also has an amendment that rewrites the bill. Is that correct?
Yes, sir. That number is 017307.
Okay, we have a motion, a second on amendment 017307. So let's go ahead and get that on the bill. All those in favor say aye.
Aye.
Opposed? Ayes have it. Back on the bill's amended. You're recognized.
Thank you, Mr. Speaker. I'd like to call a question on the bill. No, I mean, last week, Representative Hicks brought in a similar bill for the community health centers and the federal community health centers. This has to deal with OBOTs with regards to the dispensing of buprenorphine. This would allow mid-levels to administer up to 500 as opposed to their current limits today. But this only deals with 30 OBOTs across the state that are accredited by the Commission on Accreditation or Rehabilitation Facilities, or CARF facilities. And that's what this bill does.
All right. Any questions for the sponsor of the bill? All right. Seeing none, we're going to vote on House Bill 2093 as amended. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to calendar and rules. That brings us to item number 17, House Bill 2269. Chairman Boyd, you are recognized.
Thank you, Mr. Chairman.
You have a motion and a second, and we have a
Mr. Chairman, I have a host of amendments here.
Yeah, that we need to
in
get in
particular
right
order.
order.
Okay, the first one, Mr. Chairman, is drafting code 017254.
Yes. Okay, I need a motion. A motion, a second on drafting code 017254. And that one rewrites the bill. So without objection, let's go ahead and get that on the bill. All those in favor say aye. Aye. Opposed? Ayes have it. All right, and that's, we're back on the bills amended. We have another amendment.
Drafting code 017348.
You have a motion and a second on drafting code 017348. If there's no objection, we'll be voting on that amendment. All those in favor say aye. Aye. Opposed? Ayes have it. Okay, we are back on the bill as amended. You are recognized.
Thank you, Mr. Chairman. Another amendment, drafting code 017417.
You have a motion and a second on drafting code 017417. If there's no objection, we will go ahead and put that on the bill. All those in favor say aye. Aye. Opposed? Ayes have it. We're back on the bill as amended. Was that the end of your amendments?
I've still got a few more, Mr. Chairman.
Okay.
Thank you,
Two
Mr.
more,
Chairman.
okay.
I've got drafting code 017496.
Okay, drafting code 017496. Can I get a motion? You have a motion, a second. All right, if there's no objection, we'll put that on the bill. All those in favor say aye. Opposed?
No.
Let's go ahead and clerk, take the roll on that amendment.
Would you like me to describe it?
Yeah, let's describe the amendment.
Mr. Chairman, if I could describe that amendment. If we're
Drafting
gonna-
code 017496.
Thank you, Mr. Chairman. Most of these amendments are some negotiations that have been made with some of the various stakeholder groups. And one of the negotiations that was made was originally outpatient diagnostic centers were going to come out from under CON in the year 2029. And it's been decided that they would actually stay under CON for the time being. And that's what this amendment would do, Mr. Chairman. And Mr. Chairman, we've worked with a lot of folks to get this bill in a posture where it can move forward. And it's probably not 100% of what everyone on this committee wants, but I think it's about 75 or 80% of what we want. So I would ask that the members would vote in the affirmative on this amendment and we keep this bill moving forward.
Do we have any questions for the sponsor on the amendment? All right, seeing none, clerk, take the roll on the amendment.
Representative Bain. Bain votes aye. Representative Boyd. Aye. Boyd votes aye. Excuse me. Representative Capley. Yes. Capley votes aye. Representative Carringer. Aye. Carringer votes aye. Representative Clemens.
Aye.
Clemens votes aye. Representative Faison. Representative Farmer. Farmer votes aye. Representative Gillespie. Representative Hakeem. Aye. Hakeem votes aye. Representative Hawk. No. Hawk votes no. Representative Haynes. Aye. Haynes votes aye. Representative Himmer. Aye. Himmer votes aye. Representative Hicks of Hawkins. No. Hicks of Hawkins votes no. Representative Hicks of Washington. No. Hicks of Washington votes no. Representative Hill. No. Representative Hill votes no. Representative Jernigan. Representative Kumar. Representative Martin. Martin votes aye. Representative Mitchell. Mitchell votes aye. Representative Rudder. Rudder votes no. Representative Sherrill. No. Sherrill votes no. Representative Travis. Representative Vaughn. Representative Vaughn votes C. Representative Vaughn votes aye. Representative Whitson. Whitson votes aye. Representative Williams. Aye. Williams votes aye. Vice Chairman Leatherwood. Vice Chairman Leatherwood votes aye. Representative Terry or Chairman Terry.
Aye.
Chairman Terry votes aye. Okay. Representative Gillespie. Aye. Gillespie votes aye.
Oh. Can you recognize Representative Sherrill?
I'd like to change my vote to aye.
Okay. Representative Sherrill votes aye. Chairman Terry, I have 18 ayes, 6 nays.
All right. Amendment drafting code 017496 passes. We are back on the bill as amended. Chairman Boyd, you're recognized.
Thank you, Mr. Chairman. Amendment drafting code 017660, and this is so minor, it's not even worth talking about, Mr. Chairman. I can just take my word for it.
Okay. I need a motion second. Okay. If there's no objection, we'll be voting on amendment 017660. All those in favor say aye. Opposed? Ayes have it. All right. Okay. And now we are on my amendment. Now I'm going to hand the gavel over to Chairman Leatherwood.
Thank you, Mr. Chairman. Terry, you are recognized on Amendment 017728.
Yes.
Okay, do I have a motion and a second? All right, we have a motion and a second. You are recognized on the amendment.
All right, thank you. And this is a friendly amendment. And as this CON reform is going to be phased in, if we pass this bill over a series of years, I believe it's vital that as chairman of the General Assembly and that we are able to track the progress and determine the impact of this legislation on healthcare in Tennessee. What this amendment does is have the Health Facilities Commission work with me and the chairman of health in the Senate and impacted industries to develop measures to report back to the General Assembly at the end of every even-numbered year. There are a multitude of factors impacting healthcare industry right now, including basic staffing, provider shortages, inflation, reimbursement, and other uncertainties. And this legislation, this amendment will, this legislation, if it moves forward, will obviously impact the landscape of healthcare as well. And so it's vital that we as a committee and a General Assembly be informed in order to adapt.
Okay, are there any questions of the sponsor of the amendment? Seeing none, we'll go ahead and, Chairman Clements, you're recognized.
Thank you, Mr. Chairman. Does this amendment provide the Health Facilities Commission any additional responsibilities or powers than otherwise already provided in the bill?
Chairman Terry, you're recognized.
Thank you for that question. It does not. It's to get them to give a report back to us on every even year for or at least the next 6 years. Because if we adopt this bill as we move forward, each odd numbered year, something is coming out of CON, and so on the even number years, we'd like to know the impact.
Chairman Clements, follow up.
No, thank you.
Okay, any other questions of the sponsor? Seeing none, we will go ahead and vote on Amendment 017728. All those in favor say aye.
Aye.
All those opposed? The ayes have it, and we've adopted that amendment, and I will hand the
gavel. Hit the gavel.
Oh, bam. There you go.
All right. We are back on the bill as amended. Chairman Williams, you recognized?
Yes, Chairman. I didn't know if since all these amendments have been adopted, I don't know if it would be in order, but in order to save probably 2,000 sheets of paper on the House floor, if we could roll all those amendments, do you need a motion to do that?
I will do that at the end if we pass this bill.
Okay, thank you.
Chairman Boyd, you're recognized.
Thank you, Mr. Chairman and committee members. This bill affects the certificate of need process in the state of Tennessee. And the entire time I've been in the General Assembly, which is my 7th year in here, certificate of need has been a hot topic, and there's been a lot of debate and dialogue going on about it. And it probably was going on back as far as 1972 when it started in this country. But in the year 2019, the General Assembly, both in the House and the Senate, put together a working group to study the idea of repealing or reforming the certificate of need process in this state. And it's been going on now, I guess, 5 years. We've been meeting at various times during session. We've been meeting over the summers. We've met with various stakeholder groups, hospitals, physicians groups, ambulatory surgical centers, you name it. We've met with them. And we've kind of felt out and gamed it out and tried to think about what type of unintended consequences would happen. We've studied what has happened in other states, and we finally finished the working group this year, and we put together a certificate of need reform working group report, and it's available to all of you if you haven't had a chance to see it. And this bill is the culmination of that report. Now we have negotiated some things. I mean, there are some hospitals and some different providers that are going to be affected in different ways, and they've come to the table. And as you've seen, one of the amendments that we took up just a moment ago to scale something back that we felt like needed to come out from under CON, and we're putting it back under there. But this bill is essentially the results of that working group with a few changes. So let me start at the top. Even in the states in this country that have done what we'd call a full repeal, and there's a lot of people in this committee that would like to do a full repeal, even those states have determined that rehabilitation hospitals, home health agencies, hospice, methadone clinics, nursing homes, places like that are so unique because their regulation by CMS and the potential for elderly abuse, and for obvious reasons with methadone clinics that they need to stay under CON. This bill will keep them kind of in a permanent status that they will stay under CON in Tennessee. The bill really kind of kicks off. The first thing that you're going to see is in July of 2025. In July of 2025, if a county does not have a licensed acute care hospital, it will essentially become a non-CON county. And so at that point, anything can be built there. The only restriction on that would be those services that I mentioned just a minute ago that are very unique and will remain under CON. The other thing is that in those counties, if a freestanding emergency room department is built, and this freestanding emergency room department rule applies statewide, but if one is built, the only restriction on it, if you want to do one without a CON, without going through the CON process, is you have to be respective of a neighboring hospital and give them a 10-mile buffer. Other than that, as long as you're within the 35 miles that the federal government requires from the host hospital, if you're not within 10 miles of a neighboring hospital, you can put a freestanding emergency room anywhere in the state after this. In December the 1st of 2025, burn units, neonatal intensive care, ICF, IID, which is intermediate care facilities for individuals with disabilities, PET, and MRI will come out from under certificate of need. In December the 1st of 2027, ambulatory surgical centers, linear accelerators, and long-term care hospitals will come out from under CON. And then in 2029, on December the 1st, open heart surgery will come out from under CON. Now, the things that you probably did not hear me mention were cardiac cath, outpatient diagnostic clinics, and organ transplant. Those three things, although they're not in that special category with nursing homes and methadone clinics, they, for the time being, are left under certificate of need in this bill. And any service that comes out from under certificate of need will be under a new, more robust licensing program by the Health Facilities Commission that will have quality standards and various things like that involved in it. And Mr. Chairman, I could talk ad nauseum on this, but I'll stop and see if anyone has any questions.
All right, thank you. I think we do have some questions. Chairman Hawk, you're recognized.
Thank you. Thank you, Mr. Chairman, and thank the sponsor of the legislation. You have done some yeoman's work, and I will reiterate what I've said in subcommittee and all along as well. I'm going to vote in favor of this legislation, although it's very disappointing that this bill does not fully embrace the recommendations of that working group that you explained. I'm very frustrated that this bill does not go as far as I believe that it should. And very specifically, as you heard a vote on a prior amendment, in Northeast Tennessee, Ballard Health System in particular, the healthcare system and its CEO, Alan Levine, have created an incredibly divisive situation in Northeast Tennessee where they are heavy-handed and they are weakening healthcare in our region. And that's reflective of what you saw just a few moments ago. It's very frustrating that we as the House cannot go any further because it sounds like we feel some limitations from our friends across the hallway. But I want us to go further in the future in working with the individuals that were on the working group, working with individuals on this committee to take this bill further in the future. Chairman of the Board, I know you've done tremendous work, as have many others, and I appreciate that. Thank you, Mr. Chairman and members.
All right, thank you. Any Chairman Boyd, any comments? Representative Bain.
Thank you, Mr. Chairman. I also want to say thank you so much. I know I'm the freshman here, but I know this has been a labor of love from the working group, and I really appreciate that. I just want to acknowledge that this is a missed opportunity for Medicaid expansion. In 2022, North Carolina passed CON reform with Medicaid expansion, which was a lifeline for their rural hospitals. And I only wish the working group would have considered that. I also want to draw attention that the Rural Health Association of Tennessee has not supported this piece of legislation, nor was CON reform included in the Rural Health Task Force report that came out last year. So I just wish I believe in CON reform, but I just wish it was more tailored and more thoughtful towards our rural communities. Thank you.
Chairman Boyd, any comments? No. Okay. Chairman Hicks.
Thank you, Mr. Chairman. And sponsor, we've talked about this at length. You made a comment last week. I can't remember exactly the word you said, but you made a reference to healthcare and this issue is sort of fickle or something like that's what you said, and it's very true. It's a touchy subject. It's something that I have been interested in since I got here 4 years ago, and I have supported this every single step of the way, okay? Because I had huge expectations, and I took big expectations home. And it's very frustrating. It's very frustrating that what came out of the working group, I guess we'll have to wait and see what kind of mood the Senate's in tomorrow. Because, I mean, it's like every day something's coming down the pipe a little different. And it's extremely frustrating whenever you're trying to move forward with something and they throw little bricks in the road to try to trip you up every chance you get. You know, the people I serve, whenever I went home, they're over being mad. They're over being upset. They're sort of sad and they feel betrayed now. And that's tough whenever you go home. This is the biggest issue that we have in Northeast Tennessee. There's no question. I'm not going to sit here and I'm not going to throw people under the bus. And I'm not going to talk bad about people because that's not what I'm here for. But I am here because I believe in putting things together and working through things in a positive way and getting people sitting around a table and talking about issues and collectively trying to solve issues. So I want to give out a challenge. I want to give out a challenge to Ballard's leadership, all the departments. You know, the AG has a role in this. The Department of Health has a role in this. The Northeast legislators, we all have a part in this. Leadership has a part in this. And now the Health Facilities Commission has a part in this. They have big shoes to fill. So I want to try to, somewhere down this line for Northeast Tennessee, instead of putting hospitals and all this, trying to put all this stuff together to please everybody, I want to try to start pleasing the citizens of this state with good health care. I think we owe it to them, and I think that we need to work hard on that. And this bill is just not going far enough. I'm going to support it because I have no choice, because it does move the ball a little farther down the road. But it's extremely frustrating whenever we have to go home to our citizens that is struggling through healthcare. So thank you, Mr. Chairman. I hate to do that. Thanks, appreciate it.
Thank you, Chairman Boyd.
Thank you, Mr. Chairman. And members, I too wish that we had a bill that reflected the certificate of need working group. And there was another bill out there that I co-sponsored that was actually full repeal. But, you know, to quote Clint Eastwood in one of his Dirty Harry movies, you got to know your limitations. And this was very fragile how we put this together. And in order to get something passed, we have worked with the different stakeholder groups. And so, you know, sometimes you got to compromise a little bit and get about 80% of what you want, you know, to to get anything at all. And so I hear the grief and I hear the concern of my colleagues from East Tennessee, and I want you to know that I don't disagree with you at all.
All right, thank you. Representative Hemmer?
Thank you, Mr. Chairman. Thank you to the sponsor. I know you did spend countless hours working on this. I do share my colleague from Davidson County's concern that we view this as a missed opportunity to leverage Medicaid expansion and the many benefits that we know it does propose. One thing I did want to mention, I know I talked to you about this at times. We had a situation here in Davidson County this year where a hospice organization was doing a proposed merger. It would have made a group that would have owned some 70% of the market share, but yet there was still no kind of mechanism that would trigger some, I guess, reviews and availabilities of essentially some automatic CONs or automatic, approvals of more competition. So I was curious from your discussions and similar circumstances for relevant issues like that, the point of CON reform is to leverage more competition. And then why is something like that left out?
Chairman Boyd.
Thank you, Mr. Chairman. So just to make sure I understand your question, you're asking why hospice was left under CON rather than coming out and going under licensure. Is that right?
In part, why is that? But also just, if you looked at it in broader scale of, we're doing this to propose competition, but yet we still have mechanisms in place where you would have, less competition with being that things like that were left out. And so in your, in the task forces, reviews and other, other discussions, was there, was this brought up as, some other ways that we could propose some competition, for example, when something like that does happen and there is, an entity that would own a majority of the market, could it create some automatic, approvals or requests for more, CONs for these particular service lines?
You're recognized.
Yeah, thank you, Mr. Chairman. So this bill wouldn't do anything where we put triggers in there for automatic CONs. Every time someone applies for a CON, there's a process with it. To answer your question about hospice, I think we just kind of looked at what had happened in other states, and I don't remember anybody really advocating that they come out from under CON, but I have no objection to that. If you feel passionate about that, you called me over the summer and we discussed it. I would consider that a friendly amendment if you want to try to take hospice out of CON. No one has come really objecting to that. We didn't have anybody asking for it to come out, and it looked like in other states, everyone had wanted it left in there, that it just didn't work out well when it came out. But it wasn't one of our major issues that we were focusing on. I mean, I think it's, for most people, they would agree the big pinch points here were acute care hospitals, ambulatory surgical centers, diagnostic, outpatient centers, and things like that. So hospice rarely came up. So if you want to talk a little more about that, I'm happy to do that after we get out of here.
Good. All right, thank you. Chairman Williams. Question has been called on House Bill 2269 as amended. Seeing no objection, we're voting. All those in favor say aye. Aye. Opposed? Ayes have it. Bill will go on to government operations, and I ask that legal roll all the amendments into one amendment. If you wish to be recorded as a no, please tell the clerk. All right, that brings us item number 18, House Bill 2318 by Chairman Williams. You are recognized.
Thank you, Chairman and members. House Bill 2318, I do have an amendment which rewrites the bill based upon the subcommittee amendment that makes a technical change the Department of Health wanted. Drafting code 017651.
We have a motion and a second on the amendment. If there's no objection, let's go ahead and vote on amendment 017651. All those in favor say aye. Aye. Opposed? Ayes have it. We're back on the bill as amended. You're recognized.
Thank you, Chairman and members. And for your indulgence, I'm going to try to do some speed reading here since most people are ready to eat. But this bill, for the first time, will codify the scope of practice for physician assistants and place in statute their ability to diagnose and treat patients in collaborative environment with a physician, including ordering tests and durable medical equipment. It enumerates minor medical practices or procedures, which are simple laceration repair, skin biopsies, and that those may be performed without supervision in certain surgical procedures when performed by a physician. It was also provide a new authority for PAs to sign death certificates. Secondly, it authorized medical settings to exercise greater oversight flexibility for physicians' assistants with over 6,000 hours of postgraduate clinical experience, which is usually equates to 3 years of practice. If desired, these providers could be endorsed by licensing boards after demonstrating competency in their fields. Under this new collaborative format, protocols would be less prescriptive, except for in the case of buprenorphine and Schedule II controlled substances, and would allow collaborating physician and physician assistants to determine the level of oversight based on each individual's training experience and competency. The standard of care for an endorsed PA would be the same as that of a physician performing the same service. Nothing changes in statute for physician's assistants for those who have less than 6,000 hours of graduate experience, and wanted to make sure the members were aware that nothing is changing for advanced practice nurses with this bill, as they have been completely removed from what was originally the bill. The PAs are seeking to change specialties would be required to submit a sample of medical charts to be reviewed by the collaborating physician for 6 months to evaluate minimum competency level as it relates to their hours worked. Truth in advertising law would also be in place to prevent PAs from using medical specialty designations like dermatology and others unless they had the training. It authorizes the Board of Medical Examiners and the Board of Osteopathic Examination to establish a registry of physicians willing to collaborate with PAs under these new guidelines. And with this new amendment, the Department of Health wanted to make sure that we clarify the responsibilities of collaborating physicians and improve the appellate department to promulgate or to prosecute a collaborating physician for failing to fulfill their requirements, much like we do in other portions of the statute. And with that, Chairman and members, would appreciate your support. Thank you.
All right. Thank you for that explanation. Do we have any questions for the sponsor of the bill? All right. Seeing none, we're going to vote on House Bill 2318 as amended. All those in favor say aye. Opposed? Ayes have it. Bill goes on to government operations. All right. That brings us to item number 19, House Bill 2645. Chairman Leatherwood, you are recognized.
Thank you, Mr.
I need a motion. You have a motion and a second. And which amendment are we going to go with?
Number 4 there, number 017762.
Okay, I have drafting code 017762. Can I get a motion? You have a motion and a second. This rewrites the bill. If there's no objection, we'll be voting on that. All those in favor say aye. Opposed? Ayes have it. We're back on the bill as amended. You're recognized.
Thank you, Mr. Chairman and committee. This bill, House Bill 2645, was brought to me by the Tennessee Bar Association Adoption Section, and they've been working with the Tennessee Office of Vital Records. It just tries to speed up the process for issuing a new birth certificate when a child is adopted by streamlining some of the processes and establishing some timeframes and deadlines with the process. And with that, I appreciate y'all's support and stand for any questions.
All right. Do we have any questions for the sponsor of the bill? All right. Question has been called. All those in favor of House Bill 2645 as amended, say aye. Aye. Opposed? Ayes have it. Bill goes on to calendar and rules. All right. That brings us to item number 20 by Representative Capley. You are recognized. We have a motion second on House Bill 1882.
Thank you, Mr. Chairman. House Bill 1882 is very simple, so I will try to be brief in my explanation. As introduced, it requires that a healthcare provider to provide a patient or the patient's authorized representative with a full copy of their medical records within 10 working days of the receipt, instead of an actual summary. If the patient requests the full record, it can be done electronically. I think this will pair well with other pieces of legislation, and I stand ready for questions.
All right. Do we have any questions for the sponsor of the bill? I see none. We're voting on House Bill 1882. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to calendar and rules.
Thank you, Mr. Chair and committee.
Right, and I see we have one more bill, but I'm going to go back to item number 12, House Bill 2406 by Representative McKenzie. You are recognized. You have a motion and a second.
Thank you, Mr. Chair. This bill, House Bill 2406, it requires the Department of Human Services to identify any federal regulations, state laws, or any rules that they determine may inhibit the department's ability to review and approve applications and deliver benefits for the food assistance program. The department must also identify any federal waivers it deems necessary to alleviate any regulatory limitation it identifies. And lastly, this bill also requires that on or before December 31st, 2024, DHS must submit a report to the chairs of the health committees of the Senate and the House that it details its findings of any waiver applications it has submitted and their status. We're also asking that they include recommendations to the General Assembly for any statutory changes the department deems necessary to facilitate the efficient processing and approval of application and delivery of benefits for the food assistance program. This bill passed unanimously in the Senate, and I ask for your approval.
All right, thank you. Do we have any questions for the sponsor of the bill? Question has been called. Without objection, we're voting on House Bill 2406. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to calendar and rules.
Thank you, Mr. Chair and committee.
All right, I'm going to pass the gavel over to Chairman Leatherwood. We have one item left on the bill, on the calendar.
Okay, this brings us to item number 21, House Bill 2433 by Terry. Have Chairman Terry. Have a motion and a second. I see there's amendment.
Yes, drafting code 15630.
Okay, I have a motion and a second on the amendment, which rewrites the bill. Chairman Terry, let's go ahead, and all those in favor of putting the amendment on the bill indicate so by saying aye.
Aye.
Those opposed, nay. The ayes have it. The amendment goes on the bill. You are now recognized on the bill as amended.
All right, thank you, Chairman and Committee. This bill simply asks TASER to conduct a study on the effects of vaping and the use of all vapor products by people under age 21.
Okay, question on the bill? Any objections? Seeing none, we'll be voting on House Bill 2433 as amended. All those in favor say aye.
Aye.
All those opposed, nay. The ayes have it, and the bill will be going on to Finance, Ways, and Means.
All right, thank you. That brings us to the end of our final calendar. Oh, I've been told my phone. Okay, Chairman Hawk, you're recognized.
Thank you, Mr. Chairman, and a couple issues with your indulgence, please, sir. Representative McKenzie got out of the door before we could tell him it may not be the best thing in the world to say that the Senate passed this bill in this committee today. So we'll have to remind him of that as not being the best mood for today. All joking aside, Chairman Terry and folks who have served on this committee, it's been an honor for me to serve as a subcommittee chair. It's been tremendous to see your diligence in the work of this committee and these committee members. I join in with Chair Lady Carringer in the work that we've been able to do together. The meetings and the time with our attorneys and our research to get to this point has been a tremendous experience. And I want to thank you for your leadership. Thank you for the direction that you've been able to give this committee. The calm voice that you bring to this committee as we go through issues has been a very positive experience for myself and I'm sure others. So from the bottom of my heart, I want to say thank you, Chairman. Thank you, Chairman Terry.
Thank you. Thank you. Chairman Clemens, you're recognized.
Thank you, Mr. Chairman. I just want to, on behalf of my caucus, say thank you for running the way you've run this committee and operated this committee in a fair manner. I think everybody felt like their voice was heard. I receive a fair amount of complaints from my caucus members about sometimes not having their voice heard, but I had no such complaints from this committee or my colleagues who run the subcommittees, Representative Carringer, Representative Hawk, or Chairman and Chairwoman rather. So thank y'all for that. And thank you, Mr. Chairman. Appreciate your leadership on this committee and allowing our voices to be heard. And I know it's a tough job being a chairman of a committee, so I applaud you. Thank you.
Thank you. And appreciate that. And I want to take a moment to thank all the members of the committee and appreciate the work that this committee has done this year in this session. And all the flexibility you've had in creating fair legislation for the betterment of the healthcare of our entire state and our constituents. And I appreciate the debate and the decorum that we have in this committee and our subcommittees. I think it's important for a lot of people to know out there the work that is put in the subcommittees by our subcommittee Chairman Carringer and Hawk and Vice Chairman Leatherwood. They do yeoman's work to get it to this position for this committee. Also like to thank our committee staff, Mike Critchfeld, Caroline Miller, Alexander Greenberg, and Megan Dix, and our intern, Charles Lolis. Also like to thank our clerks, Anna Yankee and Caitlin Cozart, and our Sergeant at Arms, Tony Townsend and Terry Van Treese. It's an honor and a privilege to be here. And so with that, with no other business before us, we are adjourned to the call of the chair.